My name is Dr. Bob Ryder from Birmingham in the United Kingdom, and I'm presenting the EndoBarrier Worldwide Registry on behalf of colleagues from around the world who've taken part in this project. This is an EndoBarrier. It's a 60 centimetre device which is placed into the first part of the small intestine during a simple endoscopy procedure, such that the food passes through the device rather than the small intestine, as illustrated in this picture here. Over 3,000 EndoBarriers have been implanted in recent years. It's left in place for up to a year, and it's by the food passing through it rather than the small intestine. It mimics the bypass bit of the Rule 1Y bariatric bypass procedure. In 2017, under the auspices of the Association of British Clinical Diabetologists, we established this register and invited people from all over the world who've had experience with EndoBarrier to enter their data. And so far, as of April 2019, data has been entered on 871 EndoBarrier treated patients from 28 centres in 8 countries: Australia, Austria, Brazil, the Czech Republic, Germany, Israel, Netherlands and the United Kingdom. These are the demographics of those 871 patients, and you see the age is just over 50 years, just over roughly equally balanced 50% each male and female, BMI nearly 42 and 84% diabetes. And the time with EndoBarrier in situ led to a mean of 13.7 kilograms weight loss, hemoglobin A1C fall from 8.2% to 7%, a fall in systolic blood pressure and a fall in cholesterol. Since only over 15% of the patients didn't have diabetes, we looked at hemoglobin A1C at different levels, such that if we looked at patients with a hemoglobin A1C greater than 7%, the fall was from a mean of 8.9 to 7.4. And as you see, as the hemoglobin A1C gets higher and higher, so the fall in hemoglobin A1C gets greater and greater, so that with those with a hemoglobin A1C greater than 10%, the fall was from 11.2% to 7.9%. There were some side effects, particularly GI symptoms, and there were 12.5% of patients had serious adverse events, though some were more serious than others, and we classified those having most serious adverse events as shown in the top part of this table, and that was about 4.2%. Mostly gastrointestinal hemorrhage, but also some liver abscesses and the occasional case of pancreatitis, cholecystitis, as you see on this table. It's noteworthy that the percentage of patients with a liver abscess was 1.1%, which actually is a similar number to that found in the meta-analysis of EndoBarrier trials, and is significantly different from the 3.5% found in the FDA pivotal study. Taking all the information together, we believe that the balance of risk and benefit for EndoBarrier is very much in favour of benefit, and indeed all the patients that you see on this table with adverse events all made a full recovery, and most derived considerable benefit despite the setback.